It's been shown to be the most effective way to reduce teen smoking. It's been shown the most effective way to increase minority students' math abilities in a college environment. The social cure, putting people in groups and really figuring out how those groups identify with each other. So that's a whole piece of social change that we're just beginning. It's almost like it's the beginning of the Enlightenment. We're just beginning to say, oh yeah, this is really something we need to figure out how to do. And to figure out, so all of you, whether you decide to work in the corporate world or in government or start your own organization, one of the most important things you're going to have to do is try to figure out, how do I get people to behave in a way that I kind of want them to for my thing to happen? So this is a really, really interesting area to look at, because there's a lot of practical examples now from the field of social entrepreneurship about how to actually get people to do things. I'll just give you one quick snippet. So if you're working in an Indian village and you want poor people to filter their water to reduce their children's incidence of things like diarrhea and so forth, what's the best way to do it? Should you tell these people, it's really, really good for your children, this will keep them healthier and so forth? Well, it turns out the best thing to do is to say to people, because of the culture, is to say, you should get this water filter because, and you should use it in your house, because whenever guests come to your house, you'll have the privilege of serving them filtered water. You'll be able to be gracious to your guests, more gracious, and that will confer dignity upon you and upon them, and so forth. And so there's a really interesting tweak on that comes from a lot of different experimentation about how to solve social problems and so forth. And finally, the last, I think, major piece, everybody who thinks of the field of social entrepreneurship and social change kind of has it in their mind that maybe I want to start my own organization one day. I actually really think that the next 10 or 15 years is going to be, the field of intrapreneurship is actually going to be more important. And why is that? Because pretty much every company in the world now has to change. In terms of their behavior vis-a-vis a whole series of things, they have to actually shift. So how do you actually change the behavior within a large company? How do you go inside a government department and get people to behave differently? Well, there's a whole new emerging field. Some people call it intrapreneurship. Some people call it institutional entrepreneurship. And there's some researchers who have worked on this, and they've done some very, very interesting studies that look at what does it take to get a bunch of people who are kind of invested in a current system to change the way that they work. How do you actually elicit change within a company or an existing body? So that's a really, really important skill. And for any of you who want to go into the corporate world, who want to change the terms of reference and how business is practiced, which I think a lot of people want to do. I think it's something that we realize is really important. If you can get a big company like Walmart to change 1/100%, it's way more impact than if you create your own organization and raise $50 million, right? So that skill set, and the weird thing is that it's such an underdeveloped skill set. So the people who really look at that and get smart about it are going to have such a big advantage in the next 10 years, because nobody is really looking at that. It's been the social entrepreneur as kind of like the sort of white knight who comes in and builds a new kingdom and all that has kind of gotten all the attention. And so this is another piece. So I just want to kind of how much? Just check how we're doing. Okay. So I just want to kind of talk about how I would prepare if I were graduating from college today. The kind of things that I would do to sort of prepare myself for this new career pathway, because I think it's I personally think that it's a wonderful way to make a living. If you can find a job that aligns with what you really care about, that takes your interests, allows you to work with people who you respect and admire and love, and has impact in the world. You wouldn't have to pay me very much money to do that. And I think that opportunity is now available for people. But I think that there's a couple of things that are important for people to prepare that. And the most important thing, and if you think about what Lila said before and what Matt said before, is that innovation pretty much happens in the places in between fields. You know, it's those bridge people who are able to look at the world with more than one model of how the world works that really have a big advantage in terms of innovation. So if you are able to, you know, if you're in the field of, like Stephen Jobs, he was in technology, but he also had that artistic calligraphy experience where he sort of had that ability to sort of fuse those two things to create new fonts and stuff like that. If you look at people, you know, in the field of, say, for example, you know, Bill Drayton, who the founder of Ashoka, he had a very, very strong background in the environment, and he had spent a lot of years in the nonprofit world, but he had also worked as a management consultant for 10 years. And he had also worked in government for several years for the EPA. So when he was crafting his solutions, he was able to sort of look at things from different perspectives. How would a policymaker think about this? How would a management consultant or a business person think about this? The advantage that gives you is, since so much of success is the ability to communicate effectively with people, is the ability to talk to people in the language that they understand. You know, as a friend of mine has said, who speaks to a lot of bankers to raise money for his nonprofit, he says, it's much easier to change the investment or the way the investment sounds than to change the way the investor thinks, right? So if you are able to use someone's language and understand how they think, so a couple of years spent in a health field, or a couple of years teaching, or a couple of years working in finance, or something like that, gives you, or in politics, or on a political campaign, gives you an extraordinary advantage when you have a few of these experiences and you can fuse them. And the same goes for cross-cultural experiences. Like when I went to Bangladesh, you know, I just tripped over myself, you know, for a whole year. I had these translators who were sort of my guides, and they pretty much, you know, prevented me from embarrassing myself almost every day for like the first 2 months that I was there by telling me, you know, don't open the present in front of people who just gave you a present. I didn't know that that's actually a really bad thing to do. Of course, don't eat with your left hand. Do not turn down the food that's been offered to you by this person in a hut. I mean, I was constantly having to kind of absorb a different cultural, whole set of, sort of a whole symbolic universe of meaning. And now that's actually helped me a lot over the years, because I can now do interviews with a lot of different people without worrying that I'm going to deeply offend them, you know, 5 minutes into the interview. So having those cross-cultural exposures, those cross-sectoral exposures, those cross-field exposures, a couple of them, really gives you a huge advantage in being able to be a bridge and be an innovator. Because, you know, one of the really, if you look at like the field of health, I mean, we have, our society has grown into all these pin factories, you know? We have all of these specialized pin factories that do one or two things. So if we think of the field of health, I'll give you an example. There's an organization called Health Leads, which was started by a really wonderful young woman named Rebecca O'Neill. And what they do is they place young college volunteers in pediatrics wards, in public health clinics, and in large public hospitals that serve poor people. And what their job is to fill a social prescription, and I'll explain what that is. In the United States, when a poor person comes into the hospital with their child, chances are if the child had asthma or a lung infection or something else, at root, most of the time, the major problem there is related to the housing, believe it or not. Housing and nutrition are huge problems, social determinants of health. In our health system, the doctors look at the kid who comes in, give the kid an asthma inhaler, give the mother a prescription that says take with food, and then send the family home. And they don't even know if they have food. They don't know if they can fill the prescription. And they don't know if the apartment is filled with cockroaches and the window won't close, and there's all of these asthma triggers. And the way our health system works, we don't even ask those questions. And doctors don't want to ask those questions because they're afraid of what they will hear. Because if they hear there's a problem, they can't do anything. They have 15 patients lining up behind them. The social workers in the large public hospitals have like 50,000 patient visits per social worker. That's a true statistic. So you cannot begin to address these problems with our system. So here you have housing, and you have health care, and you have education, and they're not talking to each other. So Health Leads is beginning to sew these things together. They have these students who sit at the family help desk. And what they do is the doctor will fill out a social prescription and say, I prescribe for this family nutrition and better housing. And then the students have to go fill that prescription. How does a student fill a prescription for better housing? Well, it turns out that, you know, a lot of the public services that are available, a lot of it has to do with, you know, it's essentially an elaborate Google search. You're looking for services that are available for people. Where is housing available? Where are food banks available, and so forth. So, you know, Rebecca told me, she said, this is like a job that's perfectly designed for a college student because it's basically Google searches all day long.